Hello everyone, welcome to the SIT Research Talk Series, which is on the broader vision of a visionary outlook on application research, organized by IEEE student branch of Symbiosis Institute of Technology, Hyderabad, and Institute Innovation Council of Symbiosis Institute of Technology, Hyderabad. We are very much honored and delighted to invite Professor Adel on the research topic on AI innovation in healthcare. So, without any further delay, let me introduce to you Professor Adel. So, Professor Adel is the Director of Industrial Research and Innovation and Vinya Professor of Computer Science and Engineering at the Speed School of Engineering, University of Louisville. He has also held appointments at the Software Engineering Institute, at the Mellon University, and at the University of Madison. He advised over 60 master graduates and 30 doctoral graduates. His research contributions and consulting spans the area of intelligent multimedia systems, artificial intelligence, high performance computing, cybersecurity, visualization, and simulation. Its research applications include smart cities, data analytics, media imaging, bioinformatics, and computer aided diagnostics. Not only that, he is the life senior member of IEEE and was recognized for his achievements by several professional organizations, including a Golden Core Charter membership by the IEEE Computer Society at the 50th anniversary celebrations. Professor Adil has conducted collaborations, mentoring, and scientific contributions. Have resulted in research fundings, international collaborations, and published articles in many prestigious journals. So, this research talk from Professor Adil will definitely give us a very brief insight in the AI innovation in healthcare. So, without any further delay, let me invite Professor Adil to you. Thank you, Professor. Over to you.
Thank you so much. Thank you. I will share my screen now. Okay. Can you see my screen now?
Yes, Professor. It's loading. Yes.
Yeah. So I've been a long time member of the IEEE and Computer Society. That's why you will notice that my email is so easy. It's adel at IEEE.org. I welcome anyone to stay in touch with me. And I'm originally from Egypt. I came to the US in 77, and I've been teaching at the University of Louisville for 43 years, but I take leaves and go around, including, as you mentioned, Carnegie Mellon, American University in Cairo, and even in Qatar. So anyway, without wasting your time, how long do you want me to go?
You can go up to 1 hour, Professor. We have 1 hour with us.
Okay, okay, just to make sure.
Yes, yes.
So essentially, this talk, as we called it, AI innovation in healthcare, and I have done many talks related to this topic. I do modify them a little bit, and hopefully you'll find this, and I'd love to have some questions. Obviously, these days I start with the ChatGPT effect and healthcare. Everyone these days is talking about ChatGPT and generative AI, and obviously these have got a lot of attention. Why is this important? Because I get a lot of medical people, healthcare, physicians, and administrators coming to us and talking to us more about how to use this in healthcare. So, obviously, just for the fun of it, I asked ChatGPT to create some slides so I don't have to waste my energy, and I'll share what it generated with you. Uh, so, it generated some slides. I gave it the topic, and I'll share with you these slides. Uh, I edited the slides a little bit because there were some visuals that I didn't like, although I know there are other tools that can really do more beautiful slides. But I didn't want to just hop from one tool to another. Actually, I even used Microsoft Copilot in some of them. So it's a combination, but to show you that, yes, I can use it to do the talk instead of me. And That's what it said. AI innovation healthcare. We should do an introduction, talk about key technology, clinical application, AI operational efficiency. I'll go faster in this part since this is the ChatGPT generated, not mine. But to tell you, it can do some interesting things. Uh, this is one also. It just talked about how to define AI, applications, significance of growth. And by the way, many of these topics are the type of things I am including in my presentation anyway. So it talks about key technology, machine learning, natural language processors, and predictive analytic and forecast. Then it talks about clinical applications of AI, which are very important. Radiology and pathology have gained a lot of interest, and personalized treatment plans and drug discovery. I don't work on all of these areas, but they are areas that are very important, and I'll highlight some of them. Another area that some people tend to forget sometimes is operational efficiency. And resource optimization, predictive staff scheduling, enhanced patient flow management. These are all areas that the AI can do. And by the way, I kept here is generated on AI, the maker, whatever. So it's an AI generated so far. And then it really talks about a topic that's very close to my heart is the challenges, the data challenges and ethical considerations and data quality issues. This is really one of the biggest challenges we are facing in healthcare. I'm working with multiple healthcare providers, and this is really a very significant problem. And I will highlight it a little later in more details. Algorithmic bias and transparency is another one, and security and compliance. Actually, I had to write a statement yesterday about how I will implement this for a particular project with our university healthcare system. And then case studies, there are some interesting case studies that people refer to some of them. Mayo Clinic, they use it in radiology. Google Health, they did some application, although Google had issues with their AI, but they are improving right now for the healthcare. And operational efficiency, there are some very good examples. Future trends are obviously the generative AI is what everyone is talking about, and AI-enabled wearables and robotic surgery. We know that these areas are not new. Actually, many years ago, I was in Japan and they had a robot surgery. So these areas are not new. It's just what is new is that we can do more with them. And now I'll go back to my presentation. If you think that's adequate, we can stop here and have questions. Otherwise, I'll go back to what I prepared without the AI. Okay. Any questions so far or comments? No? Okay.
No,
Then
Professor. Yeah.
I'll continue. I just want to make sure we have pauses where you have questions, so if needed, we don't have to wait till the end. So I will highlight mainly why is AI now feasible and can be helpful, because I personally was in AI since the early 80s. So it's for me, it's not a new topic, and we've been doing a lot of healthcare related things in the past. But why is it now feasible and can be more helpful? In the past, it was more like proof of concept and theoretical testing of ideas. So we'll talk also a little bit about how do computers learn and make decisions, and healthcare challenges specifically with AI. I believe there are three topics that now we are facing with AI: the data, the computation, and the acceptance by the healthcare professionals and the public. Right now, we are juggling them. I see that we're getting more improvement in data and computational ability, but the acceptance is still work in progress. So not everyone accepts to have an AI doctor. Obviously, why is data now available? Because there is a big data in healthcare. We're looking at even market size. People are collecting it, exchanging it, selling it in the billions of dollars, and it keeps growing. So, why is data now important? We said it's one of the three pillars of successful application of AI in healthcare is the data, the computation, and the acceptance. So data is now almost availably perfect. The computation, that's me on a, what was an analog and hybrid computer, and this was in the US in the 70s. I'm not talking about Middle Ages. And now then we had virtual operating system. This is a VMS operating system on a DEC machine, then with PCs. This one became dedicated AI machine. This particular one is a Lisp. Lisp was an language that was used for AI. And companies developed hardware specifically targeting Lisp to make it more efficient. Go a little bit fast forward, we see now the era of GPUs, NVIDIA and others are competing, and then the era of the cloud where we are have on-demand needs for computation, and OpenAI now started, and tomorrow we're looking at quantum. We're already actually experimenting with some ideas of using quantum with machine learning. And the basic thing in quantum for machine learning, if you do good optimization implementation in quantum, you can optimize the machine learning. So we're looking at this too, and we have some work on that. Acceptability. These are some articles that I got over time. This is 22, 23, 24. Why I'm showing this is to show you that there is some progress. Over the last several years, reveals high trust in AI among gastroenterologists. So there is trust starting to evolve even from the practitioners. Uh, so there are articles about that all over the world. I just wanted to tell you. So we are getting some progress now in acceptability. I was actually at a clinician's office, and they use now a very simple AI to transcribe the conversation with the patient so they can report at the end of the day easily what were the visit purposes and these things. It's an assistant that is a background assistant. And I talked to several clinicians, doctors and nurses who love these applications. So it's a very simple one. We knew how to do uh, learning from audio transcribing for a long time, but now people are starting to accept it and use it more. And I'll go back to my fundamentals. Way back when we started, how do we teach machines? When I was in high school, I really encountered at college a visit to a university in Alexandria, amazing algorithms. I saw an algorithm that was hand coded to make the computer, which was a huge IBM taking a large room, play a game. And another one that made it play music, and another one that made it print art. These were considered very intelligent and very uh, advanced at the time. And but they were hand coded. So we hand coded our information in the algorithm itself. And that's not really uh, obviously what we want, because that's very excessive effort and very dedicated for every time you need to use something intelligent. The second level of advancement in AI were either numerical AI using Bayesian, which is a probabilistic approach. So, like gaming, decision making, you have probabilistic decision making, and that was considered as part of what I call the decision knowledge based system. So, the numerical approach. Then there was the symbolic approach that I was talking about, the Lisp machines, and these Lisp machines were more focused on natural language processing and interpretation of linguistic things. And then there came an era which we called expert systems, where we coded the knowledge as rules and information. Actually, these rules, where did we get them? We got them either from books or expert humans. And way back, we talked about what if the experts disagree. So I had publication related of multiple experts. How do we reconcile information from multiple experts if they don't have exactly the same rules? So this topic has been there from long ago. Then, actually, the area of logic programming, which implementing logic ideas, there was a language called Prolog, and this was considered a new era where Japan particularly invested a lot on the Prolog and developed some hardware specifically. Prolog is a language, by the way, a language that dedicated to like theorem proving almost using logic. And Japan was more a leader in this area than other countries at that time. But then we saw fuzzy logic. If some of you heard of Lotfi Zadeh, he was a professor in Berkeley of Iranian origin. He came up with the idea of fuzzy logic. And fuzzy logic was an important way of thinking because when we are doing everything exact, we fail. We humans do not do exactness. When I see someone, I say they are tall. They could be uh, 5 foot 9 inches, or could be 6 foot. So we are not necessarily everything has to be exact. So translating something into what was fuzzy logic became a very popular advancement. Now we are in the era of data centered AI, where AI is learning from data. And this learning could be supervised, unsupervised, and reinforcement. And I will not get in the detail. Everyone nowadays create another version of it, but it's all based on data. That's why the quality of data becomes more and more important. And this is a big issue. Another challenge that we have now, we move to some challenges. How are we getting the data in healthcare nowadays? Most healthcare systems have been built in a fragmented way. They have part related to the pathology, part related to the behavioral, and part radiology, part in billing for insurance, and different parts. So I call these, they were developed as service centric software and service centric data collection, but they were not patient centric. And why is this important? Because we worked with some companies, and the data, to reconcile it across all these systems, creates a lot of inconsistency of dates. Even the username, sometimes the patient goes in one system and they type their nickname, or they make an error. To bring all these systems together to understand a holistic view of a patient, it is not trivial. And that's the current trend, is to bring together a lot of data about the patient. So when we use the AI, we're using it in a better way. And believe it or not, when we're reporting for insurance, we're not as worried about the patient exact health detail. We're worrying about what codes for billing and things like that. Where we're talking about behavioral issues, we're sometimes talking about, do we give them medicine, send them to a particular rehab. So everything is a little bit biased in one direction or another. However, there has been a lot of success in what I call medical imaging in many areas. I don't want to get into detail. We're working in a couple of these areas ourselves, and but these are areas of success related to the brain, the retina, abdominal, every part of the body. There is a lot of successes in medical images. So medical imaging is one of these really poster child of AI these days, as it's very success, and it's been done over years. Uh, I will stop here and start sharing a little bit of work that I've done with my team members and collaborators. Then we'll go and talk more about the future and challenges. Uh, any questions at this time? Okay, I'll continue. I'll add one thing about data that I remembered. I always like to mention it. When we deal with data, sometimes omission of data may have a meaning. So we have to spend a lot of time thinking about how the data was collected. I don't know that anyone goes to the doctor and the doctor records their temperature unless they are going to the doctor because they have a high temperature. So the missing data there, the temperature, means the temperature was normal. So if we don't understand how the data is collected and put ourselves in the place of how the people who are collecting the data, we would be missing some things and not fully understanding the meaning of the data. Okay. Um, this is a topic that is very dear to me because pressure injuries, when you call them bed ulcers or bed sores, is a very difficult topic, particularly when people are diabetics. It accelerates very fast. We were working with a group from Spain and some of my team members. And actually, on a personal level, my mother was suffering from these pressure injuries, so it was very important for me. What is the challenge that we were trying to address? In a healthcare setting, there are standard forms that the healthcare people look at the image, look at the injury, and they kind of look at it and analyze it in terms of different types of tissue. And next day or next week, depending on the severity of the case, the same person or another nurse or physician go and records it. These are all based on visual, subjective views because they say we have a percentage of this tissue, percentage of this tissue, percentage of it. Why are these percentages important? Because they document the progress or lack of progress of the injury in healing. But when someone goes and you tell them, give me a percentage of this or a percentage here, how much percent is granulation, how much is narcotic, it's all subjective. So, what we really, our goal was how to do it in an objective way, in a systematic way from imaging. What are the challenges of doing this? The challenges are across different hospitals, across of different things, they are not always using the same camera. So the training of the AI had to be adjusted to the camera. And then how do we also calibrate it? The size based on the distance of the camera from the people. So they typically put a small marker so that we can use it to calibrate the actual size, mapping from pixels to actual centimeters or inches. So this is a lot of work. And the other idea, images have different aspect ratios, have different lighting. So we had to work a lot on calibrating these, and actually we have a patent on our algorithms, and we tested it with some healthcare, and we really don't have it deployed yet at a large scale, but it's one of our pride successes. Another topic that's important, colon polyp segmentation. Colon is one of the worst cancers for men in general, and actually a lot of people. But there are two topics in this. How do you find the polyp, and then how do you decide whether it's malignant or not? So we worked on this automatic detection and then automatic segmentation, then classification. So this is a topic that we worked on, and the images are typically like taken like video rather than cameras, but typically that. So we had good success rate, and this is published as well. A topic we're working on now is very important because it's a low cost. Some of the challenges of some of these technologies are the cost. So we decided to look, we're also working here with colleagues in Mexico, Spain, and actually Egypt, and here in the US to collect more data on nail fall. Believe it or not, this when you look on the nail here, under the nail, with a regular microscope, this one is like $30 or $35 microscope from Amazon, you see more of the veins underneath it, and these are representative of the health of the person. So, particularly rheumatology type healthcare, they do this. So, we have identified some people who use it, and we are now collecting more data to improve our algorithms. We had just like one publication and one is pending on this topic, but we are collecting more data to improve our algorithms. Another topic that's very important because in women health, breast cancer is the worst one. So we have published this work, and actually we do have a lot. So what we have in this, and this is a publication, and it was reported actually by a magazine called Radiology Business. They summarized our work and showed that it was very progressive. What we found out is most women at some age, usually in the US, age 50 or above, they go for regular mammography and breast evaluation for cancer. And if the doctors are suspicious, they say, come in here. So we collected data from a hospital, actually in the US, and collaborated with people across the world. And we had data of these women who were told come in a year, and a year later they found cancer. What does this mean? If they had detected the cancer a year early, they could have probably addressed it more efficiently. So we did a lot of work in analyzing these images and developed algorithms, they are published there, that can detect 30% of the cases in the same location that a year later the physicians decided there is cancer and verified it by a biopsy that showed that they have cancer. So if we could save only 30% of the women at least a year, this is very good success rate that we believe. Remember, I told you imaging is one of the areas that's very mature and has a lot of advances already. However, we looked at diabetic patients without imaging, tracking the patients and finding data about them. And when we can predict complications early, and we publish this work. This is data, is not imaging, and it's based on testing the diabetic patients over time, and we can predict ahead of time if they will have complications. That's another type of work that's mostly numerical rather than image. So I wanted to say no, it's not only imaging, is other types of data. Another thing we looked at is social media. Uh, I I didn't use it in what I want to refer to. We used it here to look at interest across the US in social media. So, what are the topics people are looking for? They vary from state to state. So, we looked at different topics related to healthcare. Topic one we did here was digital health. We realized in Wisconsin had the most, and other states had a lot of interest. But this application, and by the way, Wisconsin is where a company called Epic is very prominent in health records. Their headquarters are in Wisconsin. So maybe that's a good. Uh, Another issue here is this could use to gauge and predict health problems. When people are starting to look at a particular disease, it means they are worried about it in this region, and that could help us in public health address things before they get complicated. So this is another area where the AI can help us in public health. Okay. Uh, I will stop here and go to some what I will call lessons learned and some of my conclusions. Okay. Potential abuse of data and technology. People, this is a big area. People are worried about government misuse, insurance providers misuse, and legal adversaries. So, if you're fighting with someone and they get access to your health record, They can blame it on your health or something and make you, or if you are in a car accident, they say, oh, you're at fault because I know you had a health problem and that's probably made you make this mistake. So it could be this. But then another thing is data biases. The data itself is collected based on the current way of how the physicians, our health people are treating the patients. So if they are biased, the bias will be included in the learning, you see. And that's one of the biggest problems then is how does the bias propagate? Because we're learning from the past, not from what we want. And I'll tell you about some ideas later. Okay. So this is what we call unintended harm due to data biases. And uh, I really strongly like this because why natural intelligence is the key to ethical AI in global health. I tell my students if there is I, there is no AI. If you're not intelligent, you cannot have an artificial intelligence. So please don't undervalue your intelligence and your learning in the technical field and in the application you are trying to deploy your AI for. So, if you're deploying your AI for manufacturing, you have to be alert that you have to learn more about manufacturing or do more information. So, AI does not replace AI, actually, intelligence is key there. AI for healthcare management, I talked about this earlier a little bit, and future of patient care, curious about where, so people are talking about it. We're talking here with the hospital system. If, for example, people who went to the outpatient clinics and the doctors commented on something or had imaging, can we have the AI help alert a centralized place to call these patients if there is some fear that they may have more serious disease based on the patterns of their overall health that was collected in these clinics? That's another great idea. Uh, Unfortunately, people are also using it for claim denial prediction. So, claim denial, when the doctors or the hospital go to the insurance, uh, they may have an AI alert them, oh, the way you wrote this thing, it will be denied. So that's a big issue in the US about insurance health. So there is unexpected tool cuts unexpected death in hospital by 26%, Canadian study finds. So there are a lot of possible application in the management. And the one in Canada is based on management, is not based on the AI technique in the medical itself. So people are dreaming now. We hear a lot about uh, robotic doctors, and I know that people have deployed robotic doctors and have attempted to test it. So people are talking about the end of the physician era. This is an article about a year ago. Begin the age of the app. Well, apps are good, they can guide you, but do you want them to replace the doctor? Do you accept it? I believe that AI doctors versus AI support is like we need the two together, not a replacement. I would say that physicians and healthcare providers will not be replaced by AI. They will be replaced by healthcare providers who know how to leverage AI and are using AI to the advantage of the patient. So it's a mental shift. We don't want the AI to be a replacement, but it's an enhancement to the abilities of the doctors and the healthcare providers. I really, my lessons learned here is I believe in creating multidisciplinary teams. I don't believe you can create a superhuman, but you can create a super team. In these areas of AI and computer thing, we computer people tend to sometimes think we know everything. But we have to believe in working together with a multidisciplinary team, learn to speak their language, teach them to understand our language, and that's a very important thing. We have to listen to the industry needs and the user needs. I have seen many applications that when I use them, they are not what I want, but that's what the programmers thought and the computer developers thought. And I remind people you have to solve the right problem. We sometimes put focus, oh, that's an interesting problem. But who cares? Maybe it's a problem nobody cares. And understanding the data is very important, as I said, because it makes a big difference. I believe in the projects I do, we spend more than 60 to 70% of the time understanding, analyzing, cleaning the data than the time we do to use to apply the AI. It takes a lot of effort to understand the data, and when you shortcut this, you lose a lot. And we have to use the right tools and methodologies. Not every tool is important. That's what I put that. I have a hammer, everything is a nail. And obviously, a bad workman or workwoman thinks the tools are the problem. And we have to learn as professional computer and engineering people and software people to tell the story. Many times we have a lot of technical knowledge, but we have to convey this knowledge to our investors, our customers, our team members. So we have to learn how to explain and tell the story in a way that's understandable across disciplines, not only talking to ourselves. And that's a very important lesson we have to learn. So I'll also have my words of wisdoms here. We focus on solving the right problem, or not just any problem, right? If you thought of it, your competitors already did. Believe it or not, I may write a book about the ideas I wish I did, because every one of them became a reality, but I didn't pursue it. However, on the positive side, Kentucky is known for pizza and a lot of food. Uh, so it's all it's okay to have a better pizza restaurant. Believe it, we have every year or every maybe less than a year a new pizza restaurant that people brag about how good is this pizza. But in our simple logic, why do I have a new pizza? Pizza already there is innovation. And that's what I say even in the technical field. Or there is an AI that solves this problem. There is a company, there is a software that does that. But you can always do a better thing. So don't hesitate to think that you cannot improve on what already exists. These are some of my collaborators from a nurse practitioner, PhD, master people, MD, and a lot. And I want to thank you and pose for questions, and I can reiterate some of the ideas if there is particular interest in them. So, do we have questions?
Thank you so much, Professor. Yes, it was very insightful. Actually, yes, we have a few of the questions. Actually, let me take the questions for you. The question is, data collecting from patients is regarding using AI. If we use AI, sometimes it gives some non-correct values, even it is normal. How we can overcome situation? Even sometimes the ChatGPT does the same mistake. Can you explain in detail?
Well, we are, for example, developing app also for like collecting data from smart ring, from the phone, Apple Health. So these are collected using AI. Okay, we are collecting them, but what we try to do is understand how they are collected so we can interpret them better. Understand if there are gaps in them. What does the gaps mean? For example, if I don't have a blood pressure test for 6 months, does it mean my blood pressure is the same over 6 months? Do I interpolate it? So these data gaps, and if this is an abnormality, which we saw, could it be that the device was bad that day, or should it be really an alert that there is a problem? We can only understand this if we put it in a holistic way to look at all uh, the data across the different data types for the patient. So that's why I said it has to be patient centric, not data centric. Because say I'm looking at a particular item that was collected and the machine is wrong, can I look at it temporally and across the other types of data? This will help me understand if there is an error or not, and whether I need to either alert the patient or the healthcare provider, or actually understand that it's an abnormal uh, error in the collection. Uh, sure, AI makes mistake, humans makes mistakes. The question is, hopefully we reach a stage that the AI mistakes are less than the human mistakes. Um, so yes, the data collected by AI is sometimes in error. We use sensors, and sensors can have drift. Sensors can have calibration issues. So yes, there will be errors.
Okay. Sure. The next question is about like it is from a research scholar working in the AI in healthcare. Insights for the problems for the research scope in the area of psychology issue convert narcissistic using machine learning, deep learning, and AI.
In the psychology area,
Yes, yes.
psychology or psychiatry, just to make sure.
It is in psychology. Psychology.
Okay. Well, psychology research is very deep. Actually, in our university, the psychology department is very active, and there is a lot of interest in psychology. The question is, there are different philosophies in psychological research. Some of them is data centered, and some of them are based on human interaction and collection of what traditionally we would call uh, qualitative data. You see? So, how do you really integrate qualitative data with uh, quantitative data? In psychology, this is a big issue. We know of people who use sensors on the head to connect the reactions. We know of people, and we worked with people across the field, for example, for things related to autistic children. How do they react? And we use sensor to see the reactions to virtual reality or to scenes in imaging. And actually, the purpose here is to improve their ability to play games, which is a good thing. However, I'm also referred to things that we are working on and others are working on related to audio, because audio detection can be used a lot to estimate stress or estimate reactions. So a lot of interest, I think, will be shifted to audio. I think if you can even develop a background audio detection that relates to the psychological interpretation of people, say on Alexa or Siri or something, that would be a very good application. However, if you integrate things together, it will be better. We know that from the research we did with autistic kids and games, that the body temperature, the heart rate, also correlates to the emotional status and the psychological response of the person. You know, so it's but obviously you have to work with the psychologist to create a problem that they want to address. I know that people also, there is a company here, it got sold, I'm trying to remember the name. They used AI and virtual reality to help people stop smoking. And so that's a very interesting cycle, because smoking, people claim is physical addiction, others claim it's psychological, because many people smoke out of habit, not out of really physical addiction. So this company was successful and it got sold to a larger company. So there are many applications, and they use AI to, but from collecting data from the person interaction with the VR. Hopefully that helps answer. Obviously, there is no
Yes,
exact.
yes, yes, yes. And we have the another question also. Will there be a future where AI systems will be able to make independent decisions on the medical procedures without human intervention? If so, what steps should be taken to mitigate issues like algorithmic bias and ensure fairness and patient safety?
Yeah, this is definitely a very complex question, and I appreciate it. There are definitely, it's a multi-step issue. We have to address these biases first early when we're developing the AI. So we cannot. And because I worked in the past and I still do in areas of modeling and simulation. So in modeling and simulation, we look at the data and do what sampling with readjusting the biases. So, for example, if you have less data for women than data for men, the outcome, if you put them together, will be biased. So, how do you normalize so that if you are addressed with a data that is biased, you know, this is one type of bias, is the data collected. Another type of bias is the decisions of the doctors or the people who made the decision on these data. So there are two levels. One is the amount of data collected, and we addressed that in a paper recently that's been published in MDPI Electronics about creating a data set to reduce the biases in audio recognition of emotions. So this is one thing related to how the data is collected. The other bias is how the decision is made. So this should be addressed by what we people call reinforcement learning or continued learning. So we can also have alerts. We can use a combination of the deep learning and machine learning with an expert system. So we can put alerts based on our human intelligence that if the case involves this, then there is a danger of a bias, alert the physician more likely than another case. So a combination of fusion of different techniques together of AI should be approached. Now we hear about agentic AI, and agentic AI means there is a central AI and many agents. So one agent may be the one that is the observer of potential bias, and I say potential bias, not bias, we don't know. And this could be the agent that says, oh, now increase the alert because this potentially may be biased. So you can address it at the upfront from the data collection and understanding the human bias that existed. For example, in the US, we have a typical issue of biases had to do with loans, mortgages for homes for people of color. So if you already know that, then you can increase the alert for this either by geographical area, because these were tended to be in geographical area, or by a profile of a person based on income, ethnicity, educational background, and even in healthcare, we do hear a lot about biases for people with less educational background or with people sometimes of lower income. And recently I heard of biases that physicians are sharing with me that they observed from their colleagues about people, for example, who have a psychiatric issue or an emotional issue. The other physicians don't have the tolerance to dig deep and understand the true diagnosis, and they just assume they are not smart enough to talk to them. You know? So, yes, biases exist, and we have to remove them from the people first so that the data in the future will be better. And that's the continuous learning and continuous adaptation of the AI. Does this?
Yeah, yes, yes, Professor. I think this covers our Q&A part.
I am thankful, and maybe next time. I still haven't visited India. I will visit you sometime. And I was planning to go to India next week, but I had to cancel actually. But but thank you and appreciate it. And if there is a way to share the video with me, I would appreciate it.
Yeah, definitely, Professor. So I think you're able to see my screen. So on behalf of the Symbiosis Institute of Technology as well as IEEE student branch, I would like to thank Professor Adil for the fantastic talk on the AI in healthcare. So with really thank you so much, Professor, for kindly accepting our invitation and being the speaker for today. And definitely, when you're coming India, please let us know. We'll be definitely happy to host it at our university.
Thank you so much, everyone. And the students, you are our future. I urge you to just take care of your future and make sure you continue this path. You're in a wonderful area. Take care.
Yeah. Thank you so much, Professor. And dear participants, we have shared the feedback form to you in the group. We will be happy to hear your feedback. And coming up to the next talk, the third talk in the SIT Research Talk Series, which is by the IEEE Computer Society past president, Ms. Nita Patel, who is the Director for Engineering Lead Design Center at ODS. We'll be talking about the visionary outlook on emerging technologies on the coming Monday on 9th. So we'll be happy to host you all. So with this, thank you so much and have a great day. Thank you.
And thank you. She's an amazing person. Glad
Yes.
you have her.
Yes. Thank you, Professor. Thank you.
Bye bye.